like me, always get sick, especially with the common cold?
Well, if that looks a lot like you during this flu season, and you're taking pseudoephedrine while also taking antidepressants, maybe you should reconsider. Let's go over the background information regarding this medication and why it isn't the best medication to take while on antidepressants. Pseudoephedrine is a medication that is commonly used as a decongestant to relieve nasal congestion caused by conditions such as the common cold, allergies, or sinusitis. Common brand names for medication that contain pseudoephedrine includes Sudafed and Actifed. However, pseudoephedrine is the common generic name for it. Just as there are different brand names for medications containing pseudoephedrine can be combined with other drugs such as antihistamines or pain relievers like ibuprofen. Pseudoephedrine is specifically not great with patients who have hyperthyroidism, heart disease, or high blood pressure. Additionally, as I alluded to earlier, taking pseudoephedrine while also on antidepressants may be dangerous. Let's take a look at why.
The reason this is risky is because pseudoephedrine can interact with some antidepressant medications, particularly those that affect serotonin levels. Combining pseudoephedrine with monoamine oxidase inhibitors, or MAOIs, or selective serotonin reuptake inhibitors, or SSRIs, can increase the risk of serotonin syndrome, a potentially serious condition. Thus, it's crucial to inform your healthcare provider about all the medications that you are taking, such as antidepressants, to ensure that there are no contraindications or interactions that are unwanted. Besides being a decongestant, pseudoephedrine has stimulant effects, meaning it can induce faster heartbeat, higher blood pressure, and maybe even trouble sleeping. Thus, people who have taken antidepressants while taking decongestants like pseudoephedrine have proven to sometimes have greater irritability, headaches, insomnia, diarrhea, and other blood pressure effects. Some people also experience orthostatic hypotension, which is low blood pressure while standing up, and dizziness.
The medication Robitussin contains two active ingredients, guaifenesin and dextromethorphan. Guaifenesin, also known as Mucinex, belongs to a class of drugs called expectorants. These drugs help loosen up and thin the phlegm or the mucus in your throat and lungs so that your coughs are more productive, and in total, this relieves your chest congestion. Dextromethorphan is an antitussive drug used to help relieve constant coughing, which it does by decreasing activity in your brain that triggers your impulse to cough. In general, this medication is not recommended to be taken with antidepressants due to the high risk of serotonin syndrome, which would cause high blood pressure, changes in your body temperature, issues with muscle movement, and mood changes. Additionally, this medication is not recommended if you are exhibiting high blood pressure, diabetes, a glaucoma, epilepsy, or other seizure disorders.
Hi everyone. So given the raging cold and flu season, I thought it would be appropriate to talk about Tylenol. So Tylenol cold and flu typically addresses symptoms like fever, congestion, body aches, while Tylenol cold, flu, and cough includes ingredients that relieve cough symptoms in addition to those addressed by Tylenol cold and flu. So Tylenol's main active ingredient is acetaminophen, which is a pain reliever and fever reducer. It works by inhibiting the production of certain chemicals in the brain that cause pain and fever. So it is really crucial to consult with a healthcare professional before taking Tylenol and other medications to see if they work together. Certain antidepressants can interact with medications containing acetaminophen and potentially lead to harmful side effects. So some common contraindications for Tylenol include allergies, liver issues, and it doesn't go well with alcohol. And again, different medications, it's important to see that they pair well. Always consult with your healthcare provider and read the product labels very, very thoroughly. Even though it might take a little extra time, it's always worth it.
Hi, my name is Aditi, and I'm here to talk to you about Mucinex, which is a collection of an over-the-counter medications for cough, cold, and flu symptoms. So the main ingredient of Mucinex, which is guaifenesin, helps loosen and thin mucus in the airways, which helps it easier to cough up. And Mucinex DM, another form of Mucinex, has two active ingredients, which is guaifenesin and dextromethorphan. And to get into more detail with that, according to Mucinex.com, Mucinex has 8 different active ingredients, such as acetaminophen, a pain reliever / fever reducer, dextromethorphan, a cough suppressant, guaifenesin, an expectorant, phenylephrine ACI, a nasal decongestant, triprolidine ACI, an antihistamine, oxymetazoline, hydrochloride, a nasal decongestant, and finally doxylamine, succinate, another antihistamine. Now that was a mouthful, but before moving on, there are a few different versions of Mucinex that one can use. That includes Mucinex Sinus, Mucinex Cough and Chest Congestion, Mucinex Multi-Symptom, and Children's Mucinex. And with all medications, there are a few contraindications, and with Mucinex, it cannot be used for children aged less than 12 years old, and it may not be suitable for people who have persistent cough due to asthma, bronchitis, emphysema, or even smoking. And it can also affect people who have a cough that is producing like excess amounts of phlegm. And if one is pregnant or breastfeeding, please talk to a doctor first before using the medication to be safe. And combining drugs such as antidepressants and decongestants such as Mucinex that both elevate serotonin levels can cause irritability, headache, insomnia, diarrhea, and even blood pressure effects. So some people can even have dizziness, so just be careful when using Mucinex. So all in all, Mucinex is a cheap and efficient way to clear up sinus, cold, cough, and fever-related problems, and especially during a time where viruses and allergies are most common during the season. So yeah, just feel free to buy Mucinex. Thank you.
Hello, my name is Jordan, and given that it is cold and flu season, I will be addressing the drug Benadryl. To begin, Benadryl can be used to treat both cold and allergy symptoms, such as but not limited to hives, watery eyes, and itching. The components of this medication include diphenhydramine hydrochloride, which is the active ingredient. Benadryl exists in varying strengths, and some contraindications include nursing mothers, as well as individuals who experience hypersensitivity to diphenhydramine hydrochloride. If taken with antidepressants, Benadryl can lead to side effects such as drowsiness. Thank you.
Hi everyone, so today I'm going to be talking about the differences between Dayquil and NyQuil. Many of us have already heard of them. They're basically used to treat cold or flu symptoms, but the main difference is that Dayquil is used during the day because it's not drowsy, while NyQuil is used usually when people go to sleep because it does induce more drowsiness. So the main reason why it does that is because NyQuil have something called antihistamines. So in terms of the medications themselves, both of them have something called acetaminophen and then dextromethorphan, but the difference is that Dayquil has phenylephrine, while NyQuil has the doxylamine, and doxylamine is a type of antihistamine that I mentioned earlier. So how the doxylamine works is it helps you sleep at night because histamine, which is produced in the brain, basically increases your feeling of being awake. So when something called antihistamine is used, it does the opposite, where it makes you feel more drowsy, but all in all, it does treat your cough and flu symptoms.